There's an apocryphal story that Winston Churchill once said, you can always count on Americans to do the right thing after they have exhausted all the other possibilities. How does that apply to American health informatics today?
My goodness, that's a zinger of a question.
Let's hear a zinger of an answer.
Does anybody in the audience know?
I don't think they do. They're hoping you're going to tell us.
I don't know.
So what are we doing wrong?
I don't know. Should we?
For example, read an article this week that we can now roughly be able to implant things in people's brains. And yes, they can move a little car around, but we can also understand what they might be thinking in language. This looks like a huge invasion of privacy.
Yeah.
So what about the issue of privacy in health informatics?
It's a zinger. That's something we worry about every day because you're dealing with PHI, HIPAA.
Yep.
I'm sure everyone out here knows what HIPAA
Nods in the room, yeah.
And now we've got cybersecurity to deal with. I hear about that at every conference I go
Really?
to.
What are the issues there? I mean, is it because people are sloppy and they get attacked, or they are not sloppy and they still get attacked?
I once heard that the medical record, a stolen credit card number was worth maybe $10, and a stolen medical record is worth maybe triple that.
Why? Is it, I mean, I understand that if you have, you're running a clinical trial, you do need people. But is that the way to recruit them?
This is a tough field. Definitely makes innovation hard in health IT. So we have to think about things like PHI and privacy and, DNA. There's so much data out there. How do we consume all this and what do we do with it? And are we overflowing our clinicians? They're drowning in data. And then how do you keep that data secure? I see some nods in the audience. Does anyone want to comment?
Oh, yes. Folks online, feel free. One of the challenges of this format is people tend to be quiet.
Yeah.
When they should.
Quiet in here.
Mm-hmm. Mm-hmm. Okay. So let's go down a different avenue. Somebody sent in a question that kind of challenging.
Uh-oh.
I'll just start with the first.
And I didn't get a preview.
Do you support the role for librarians on research teams as they can provide systematic reviews of research literature and help format future research?
I've never really thought about that.
You're in a library school.
Yeah, I know. It's intimidating.
Mm-hmm.
Do they still have the Dewey Decimal System?
Yes and no. There is the Library of Congress system.
Yes, I would support that. When you think about literally the petabytes of data that our clinicians now have available to them, and how do they synthesize all that to make a decision for the patient? How can informatics help with that? We've got so much information now. And actually my background is from the clinical laboratory in the hospital, and I just met some colleagues on the southern end of campus today over now at Health Sciences Department. I asked them, I said, what's the current statistic of how much lab data makes up the medical record? I said, it used to be 70%. She corrected me and said the latest is 90%.
Really?
This is clinical lab data.
Is it because of things like genomic data?
Genomics, all the testing, actually imaging, MRI results, CT scan. There's a lot of innovations in imaging to help us with diagnostics and theranostics and figuring out the right therapy for the patient. So, yes, I think back to your original question, I've never really thought about that, but I do think there's a place for a librarian because they're really I'm not a librarian. Is anybody in the room one? Is anybody School of Information and Library Science? No one? Anyone out online? They're really good at organizing data, is my understanding. And forgive those that are librarians. It's definitely not my specialization. But if we have someone that maybe has a hand up.
That's Deborah Swain.
Yes. I'm actually more of an information scientist, but I've always worked in the library school. And the interest was in collaborating with research teams to help them better prepare what they needed to know for presentations, systematic reviews, like from South Carolina. I've worked with people, and you've got enough to do the research. So we are to collaborate and partner.
So let me ask, this is just generally, we're in a situation now of this explosion of data and information. And it once was a time, if you knew your way around mesh terms, you could find out a lot of things. Has that gone by the side of the road?
A lot of people still use it, but there's so many other ways to search now too. Yeah, definitely.
Okay. I
But
think we had something in the room.
For library sciences and information. So I see they are the people who can have a repository for all information all over UNC. I also okay. I also may use their technical expertise in some aspects, R and Python and this stuff. So they also do deal with informatics in different way.
Thank you. Thank you.
So in a sense, what we're saying is these are people who are schooled in an ancient as well as a modern art of understanding how knowledge is organized and may help people understand it. But I have a little something here.
Uh-oh.
So for the folks at home, I have 2 volumes here. One is essentially information systems, policies, and procedures. I used this a lot when I was an IT director. And I chose this instead of something in health informatics as I didn't want to raise enough hackles to not make it out of the building alive. But this is a very heavy tome. There are no pictures.
What year was that published?
It was in the 90s, late 90s. Okay. This is Edward Tufte, Envisioning Information, published 1990, I think. It's essentially all about how you use imagery to present information. So if you had to give one volume like this and another volume like that to an informatics student in health, which one should they curl up with?
I gotta go for this one. The visualization.
Why?
It's much easier, think about in healthcare, you're working with a patient. If you're not in research, if you're in clinical setting, and you need to make decisions, sometimes kind of quickly. So how do you synthesize all that information and make it usable? And how do you make sure that needle in the haystack doesn't get lost and you alert the care team to maybe that one critical lab value or that one finding the pathologist saw or something that came up in imaging? And how do you piece that together for these are kind of the diagnosticians, but how do you piece that together for the clinician, the care team, the physician, that's maybe standing bedside to the patient trying to figure out what's our next course of action, or even do we have a diagnosis?
Deborah.
I love the Tufte book, and when I was working for IBM, he came to present. He always talked about how the book paid for a wing on his house at Yale. But my favorite map is Napoleon crossing Europe. And he
Everybody
always
looks at it
shows
that
you,
way.
you know, the line gets thinner as soldiers die, and yet you see where each storm occurs and where each battle occurs, and great visualization it really is. And we can all use things like that, as you say, to improve our data and how we present it
Yeah.
to each other and students. Thank you. I agree.
So is this something that should be incorporated into Epic or Cerner?
I think so.
But it's not.
Well, I think we're getting better.
Okay.
I think, you know, if you think about the EHR, the electronic health record, raise of hands online and in the room, who's ever logged in to an EHR?
We have a couple in the room,
Okay.
3. Okay. And online,
How many?
a handful, a half
Okay.
dozen or so.
So the first one I logged into was the system UNC Health had prior to Epic, and I'm forgetting what it was called, but it was homegrown.
Yeah.
They developed it here, and it was probably on a server under somebody's desk in the IT department. And it was green screen. It was character based. It was not visual at all. And then I've used a few of the other ones out there. I think we're getting better. I think about the fishbone diagram of lab results. Does everybody know what I'm talking about? You know, something super simple, but it helps.
Some people don't.
Some people don't.
Please explain it to me.
I wish I had a picture to show it. It's literally a way of presenting lab results that you can quickly kind of see maybe the patient's hematocrit, hemoglobin, you know, maybe a Chem 7 panel. And I'm doing a terrible explanation of this.
So the idea was like a fishbone, there are spines coming out from a central.
Yep. And there's certain places where certain data points are. Somebody will have to look that up and maybe next class. I don't have a picture of one today.
Okay.
But simple visualizations like that. But then you think about all the other data that's in these systems, and then get really complicated, all the systems that are maybe interfaced, or maybe they're not interfaced, or maybe the interoperability is not where we want it to be. So you've got silos of data. So how do you bring all that together in a usable way?
ICD is almost 200 years old. HL7 has been around for 40
forever.
years.
But when I always laugh, standard HL7, well, there is no standard. It's your flavor and your flavor and your flavor. So I still think we've got a way to go. And perhaps some of the folks sitting in this room and that are online, you know, there's still areas. I've actually been working with a hospital in Florida that they don't have great connectivity with their reference lab. So they don't do all their testing in-house. So when clinicians are trying to get microbiology tests done, that's sent out to a commercial reference lab. And it doesn't always come back in a place in the electronic health record that's easy for the physician to find and then communicate back with the patient.
So we've got one of our participants online saying the early EHR era was clunky because vendors kept layering new tools onto old systems.
Of course they did.
Do you see the same pattern happening today with, AI and digital tools, or are we finally building systems the right way?
Oh, that is an excellent
And I knew
question.
somebody was going to burst through that barrier.
Thank you. 10 points to whoever asked that question. That is, I think that's going to involve some discussion here. I'm not the expert, but what I've seen is, yes, vendors are actually still layering new releases on old technology. One place I used to work, the tech stack was literally probably 20 years old, and they kept trying to get to market commercially with minimum viable product, MVP. Why? Because it generates revenue. So they kept layering the next release and the next release and the next release on the old tech stack. And I don't know if they've actually solved that yet. I'd have to ask someone more technical. But now we've got AI, which it is the popular buzzword now, right?
But is it, I see it as potentially having a role at both ends of this process. At the part that people focus on, the results, the delivery, the synthesizing, that's an end product.
Yeah.
But would it not, based on what you just said, be more beneficial to essentially refactor the code using AI with a much more modern language, better technology, and be able to get that minimum viable product out the door more easily than we ever could before?
On a modern platform,
Yes.
a modern language.
Yes.
How do you do that ethically? How do you train the AI? What's it called? Hallucination?
Well, but this is code generation.
Yeah.
And you can have one AI system talk to another AI system, and the second one is always looking for bugs.
That's true.
And the point is, it's not doing it in a black box. There is a software engineer that is essentially specifying it needs to do these things, and they've already been written down. These were specifications for that stack that you mentioned.
We assume they've been written down.
Well, okay, yeah, you got a point.
Is there technical documentation?
True enough, and I'm guilty, Your Honor. Wrote a lot of code, didn't write the documentation.
The technical documentation, or wrote technical documentation, but not the end user training.
But we're all right. So now we've opened the bottle, the genie's out. AI is in the room. What is the best role for it?
I know how I've been using it in my world, both personally and professionally. And I'd love to hear from some people in the room how they're using it. But healthcare is always, or at least my experience in healthcare IT, this is just one view. I'm sure I'd love to hear some others in the room. Sometimes our innovation is slow because it is a high stakes, high risk area. You don't want to make a mistake. And there's even portions of, there's medical devices, and then there's software, and there's firmware sometimes on the med device. And depending what the software does, sometimes it's FDA regulated, classified as a medical device or not. When we think about EHRs, there's a few areas that are maybe a little bit more regulated. The blood bank system, fetal monitoring, pathology, radiology. Think about those pieces that are a little bit more heavily regulated because they're making that diagnostic, supportive information that's helping the clinician or the diagnostician make that decision. And maybe that, because we have that regulatory process, we haven't been able to innovate fast enough. And I think the technical people can do it. That's not the question. The skill sets are there, the technology's there. But how do we do it where we're accurate, it's specific, and it's sensitive? The specificity and the sensitivity.
So
we don't want to make a mistake.
True, we don't want to make a mistake, but then we still want to be able to get the thing out the door, so it can actually be used. So last week in this seminar, we heard a developer from Wake Forest talk about software as a medical device. And he was essentially, hold up your watch. We both wear Apple Watches. And he has developed software that can take the vital sign readings from an Apple Watch and be able to use it to predict likelihood of heart failure, even in people who don't necessarily show symptoms. And the idea was this would be an early detection device, perhaps years before. But in order for him to be able to do this, not only did he have to get the funding, do the research and all that, but he also had to find somebody who was willing to fund turning this into a business for him.
Right.
Is that what is necessary? We have to start businesses from the lab to be able to reach the bed and beyond?
That is a great question. I just saw a note about one of our health systems here in North Carolina that has a presence in North Carolina is trying to take a different approach to clinical trials. Get it out to patients faster so they can enroll. And I encourage all of you to read up on that. But the health system in the US, one thing that I think is really important to understand is the revenue cycle side of things, fortunately or unfortunately. Unless you've got a benefactor or a donor or a PE firm, you know, it does take some funding to bring these innovations to market. And I don't know how much time we have today to talk about commercializing solutions and what that's involved, but how do we take it from the lab or the classroom or this group of innovative minds that are in this room, and how do we take the ideas from, you know, the drawing board, innovate it, commercialize it, and then get it out into a patient care environment.
So is that a career path that you think an informatics student should consider?
Absolutely.
But that sounds really scary.
It does, and it's really hard. What's the stat on how many startups actually succeed?
Usually 1 in 10.
1 in 10, 1 in 20?
But I've done my first one, absolute personal and financial disaster. The second one was a gigantic disappointment. The third one was meh.
Yeah.
And then I stopped because I just ran out of emotional strength and my wife was ready to kill me.
Yeah. Understood.
But that's a very different kind of idea than what an academic institution often fosters, at least on this end of the campus. Maybe over the business school, it's different. But I mean, so if anybody's online or in the room, share your thoughts about the viability of this as a career path, and how would you guide someone's early steps in going about it?
Yeah. If you've got an innovation, and how you do have to eventually get it to market, you can give it away free to start. If you've got some PE funding maybe to do that. And why would you do that? Because you want to get adoption. You need to get that first customer. You need to kind of test it in a live environment. So you might want to partner with an institution that's willing to kind of work with you. Academic medical centers do this a lot. They have an innovation hub. We were actually just talking about that. So this early detection device on the Apple Watch that can maybe predict heart failure, you know, how do you get that out there? So you may have to do some free trials at first, figure out your commercialization model, which can take a ton of time. Is this viable? Is there a market that's going to invest in this? Does it solve a problem that we're not able to solve today? How are the people that are going to buy this doing this today? And does this solve the problem, you know, better, faster, cheaper? Is there a return on investment with it? So yeah, I think you have to look at things like that. And then once you understand, is there a market, you figure out how to take it to the market. Getting that first customer can often be the hardest. Get the bugs out of it, and then how do you scale that? How do you get the second and the third, fourth customer?
But earlier, you talked about the first electronic health record system here at UNC.
Yeah.
Homegrown.
Yeah.
Okay. And then it was replaced by Epic.
Yeah.
And $1 billion later, literally $1 billion.
Billion, probably.
Yeah, by now.
Yeah.
They have a system.
Yeah.
But I remember when the Epic was being implemented, there was a great outcry among the research faculty that this was not addressing their needs for research data, you know, even with privacy and so forth. So it sounds like quite often for a lot of people, the pathway to at least making a living is you sign on with a company that already has the product,
Mhm.
the presence in the market,
Right,
and the like.
right.
So what are those companies looking for when they're thinking about hiring the brand new
Yeah.
shiny graduates?
Come in and disrupt what they've been doing. Don't be shy. I think, bring your ideas, question things, look at it differently. It's okay to have constructive feedback and constructive criticism. And I think we can't accept, just because we've always done it this way, to continue to do it. And I think that's what's so exciting about this. As long as you have the right values and the right mission, whether it's earlier detection of heart failure, um, a better treatment plan for colon cancer. It's very mission-based work. But I would say employers, they are looking for that skill set of understanding the clinical and the technical. And the one thing that's always kept me successful is staying close to the customer. So I think about my career journey in health informatics. I was just reflecting on that earlier. I've always been in a role where I actually talked to the end user that was using the product. And that's how we got feedback. Are we hitting the mark or not? The customer will tell you where the gaps are, whether it's research, can't get the data out, it's not fulfilling the research mission of the institution. Well, how do we do that?
So we're almost halfway in. Who are you again?
Well, good afternoon, everybody. Thank you for playing along. My name is Allison Toomey, and I'm excited to be here today to talk to this exciting program. I am, just a quick introduction, I'm a UNC alum. I graduated my undergrad from the Clinical Laboratory Science program in the School of Allied Health Sciences. And worked in a little laboratory called the Educational Technology Group. I don't know if it's still there or not, the ETG. But when I was coming through school, the first class of medical students got their first laptops. And that's when I learned, okay, what's this thing called informatics? Because I was going to work in the hospital laboratory and do blood banking and microbiology. And I got exposed to, there was a couple of physicians that were digitizing their lectures at the time, putting them in this thing called PowerPoint. And the first crop of med students were coming through, and they all had to have a laptop. And we had things called Palm Pilots. And the world was open to me. And graduating UNC, I moved with probably 10 cents to my name to California, and I started working for a medical device company that made software that managed the transfusion medicine service in the hospital. So I started in the lab, and then I went on to work for other big companies in commercial roles with commercialized software that was already in the market, EHRs, 2 EHR vendors. One sent me overseas to work in the UK, and I got to understand and get exposed to the NHS, which was a wonderful experience. Very kind of different approach to how health systems procure technology. And then most recently, I've worked for GE Healthcare for almost 10 years. Kind of learned the EHR side of things and wanted to go learn about imaging. So I worked on the radiology information systems, the PACS and the cardiovascular, and got to work with teams that were very, just fantastic experts in imaging. So come back around, I've been doing some consulting, and I've basically been in healthcare IT for almost 25 years now. Seen a lot of change. I'm excited about what is happening right now with some of the AI innovations and what's next.
So there was this book published in 1995 by Nicholas Negroponte they titled it Being Digital. And it was all about this brand new age that was opening up. And everybody was so excited because we were moving from considering atoms to considering bits. Okay. And the idea was the world is becoming digital, and how do we figure out to, work in that? Well, now, 30 years later,
Yeah. Has it been 30
everything,
years?
everything is digital.
Everything.
So are we now looking at these bits starting to manipulate atoms? So, I mean, when you think about AI
Yeah.
and robotics and things, even laboratory work, sequencing uh, genes and
Yeah.
genomics and CRISPR and all of that. So, I mean, we are in a place where clearly the software has trumped the hardware. But hardware still has a place. Those atoms really do matter because that's where it affects us,
Yeah.
whether we're patients or customers or
Yeah.
clinicians and so on. So, I mean, just in thinking about that process, you lived through professionally a lot of it. How, I mean, these are people who grew up in this digital age.
Right.
They are, they probably had a device in their hand,
Since birth.
that this is 1,000 times, literally 1,000 times more powerful than the mightiest supercomputer sitting out in the park, rusting away at the microelectronics center. And yet it fits literally
In your pocket.
in my pocket.
Remember punch cards?
Oh, yes.
I'm not that old.
One of my professors had boxes of them, and he was worried they were going to get too much humidity, and therefore they would never run anymore.
That's how you used to have to register for classes.
Exactly.
Now you just go online or just tell AI. Can you do that yet?
No,
Not.
So-
It will soon. Hold on.
it would make things a bit nicer during
Yeah.
registration.
We had to sit in our dorm rooms and dial the phone over and over, and it was called Caroline.
But what, I mean, this is a profound change,
Mm-hmm.
and it took a generation, okay, which typically is it's not been it's been rapid, but not literally overnight, although some things seemed that way. But as you're considering a health informatics curriculum, and you're looking at, well, I'm in a master's program. What kinds of questions should you be asking your professors to challenge them? Not that any of you would.
I think we should see.
So let's ask the audience.
Yeah.
This is the audience participation part. Hang on. So pretend you're a student. So for some of you, that's easier than others. Given what I've just said about this transformational change, what are you worried about?
We'll all speak at once. Here we go. We get the microphone. And those online, feel free to raise your hand.
In this transformation, I may have concerns in ethics
Ethics.
and my privacy. To what extent it will be broken. That's even when I use maybe Copilot for assignments or something like this. I may also use my name, my BID. So I have concerns on this. And is it safe to share this? To what extent they will use my information to buy them? So,
Yeah. Are there bad actors out there that in the wrong hand? This could be
actually, this is about also commercialization, as you said. So they did the AI model to have a profit, and this is the profit they will use the information they got. sooner or later it will be cheap.
Yeah,
Yeah,
that's why we
de-identify the data.
It's a whole nother.
That's a whole nother
right?
topic, right?
But
But
how much
how much, I mean,
clinical data?
clinical data, maybe, because there's HIPAA.
Yeah.
There are
There are laws that govern the use of that data because it is
personal
personal health information.
But
But
in
in every other part of our life,
we get these
we get these free services where
we're the ones offering the data. So, Deborah Twain, you have your hand.
My concern, if I was still a student, will there be a job, and what kind of job can I apply for? I know you're into growth development, and I've seen an awful lot of changes. I've worked for IBM and AT&T, and then taught for 22 years, and I'm not sure what to tell students now. You're gonna have to be flexible and change, but I'm not sure what kind of jobs you'll have.
Yeah, I don't worry about that. Maybe I'm wrong, but I'll give my sort of analogy and an opinion. I get asked that question a lot, and one story I tell is the job's going to change. The tasks at hand are going to be different. There's some things that can maybe be left for AI to take care of, and then the skill set might need to be adjusted of what the person's doing. An example I think of, actually, one of my people leaders used to tell this story all the time. Just think of a simple example of the grocery store. You have self-checkout now. So what are the people doing that used to check you out? That job kind of got eliminated. Well, now they're doing Uber Eats or grocery delivery. So it evolved to something else. We didn't used to have that. So I think it's going to evolve. The skill set's going to change. Physicians, I've seen some job postings lately for physicians to train the AI. Isn't that fascinating? Get paid to train the AI?
Oh, Aiden, Yamnas. Oh,
Okay, concerning positions and jobs, a couple of days, HEMS has recently published a new job description, new edition, and they included about 4 new jobs for AI. And this was with job description. I'm not sure if companies now will offer them, but I'm just watching.
Do you remember?
Do you remember what they were? That's fascinating. What were the 4 new roles?
I cannot check them and tell you.
How do you check that?
How do you check that? That would be interesting to see what HIMSS is saying.
I've been involved.
I've been involved with HIMSS for
time.
a long time, been to a lot of conferences, and it's definitely changing, and they do a great job, paying attention to policy. So, there's chief AI officers now.
There
are positions to train the AI. There are there's a lot of discussion about AI governance.
How do you set
And how do you set that up, and why is that necessary?
we have an AI czar here
Yeah,
as of this week.
brand new.
Well, he was dean of SILS,
Okay,
but they promoted him.
excellent.
So what does
So what does that, he should be your next speaker on.
if we could get him.
Yeah.
That's Jenny's job.
Okay.
But I mean, and it's appropriate that and any institution, but particularly one like this one, has someone who is essentially got a job of trying to not just understand what's going on out in the world, but also how can the institution contribute to that. But I mean, one of the challenges in an academic curriculum is that you've got courses you have to take, requirements you have to fulfill, papers to write, whatever it is. And yes, I will get around to grading all of those.
Just have the AI do it.
I tried.
Doesn't work yet?
Not yet.
We need to get somebody to train it.
I agree. I gave it a rubric, and quite literally on the third student's assignment, it was acting as though it were tired and got lazy. And the feedback wasn't nearly as good as on the first two. So I said, and it took so much effort that I said, this is ridiculous. So I went back to the traditional way. Yeah, yeah. But I mean, part of this is you're a student, you've got these things you have to do. They're mandated, and somebody else figured out what they were supposed to be.
Right.
Where is the place for you as a student to flower the creativity that you may have?
What careers are out there?
Well, just not just that, but you know, should students create interest groups
Absolutely.
to look at these kinds of questions?
Absolutely. If you're not already in some sort of focus group, you know, you've got your curriculum and the syllabus and the coursework and the required courses and the electives you have to take. You know, I think everybody's probably working towards a degree here. But don't wait on that degree, would be my piece of advice. Get started now if you're not already. Networking with like-minded individuals. If you're actually, could I have a raise of hands? Who's got a clinical background that's in the classroom?
Online?
Online?
Please raise your hand.
And I'm guessing there's probably some technical background, IT, computer science. How many are technical? Okay, business? School of Information Library Science? Who am I missing? What other, or none of the above, something different? What are the other backgrounds we have in the room? Put it in the chat if you're online.
Yeah, there's one person who has fessed up to be a clinician.
Okay, so we have some clinicians in the room. What am I missing? Clinical or technical, okay. And I think it's important for those two mindsets to work together because they bring a different skill set, and that's what's so interesting about this. So start those focus groups now. Get involved in meetups or innovation. I was actually just asking right before this talk, is there an innovation center on campus? And you mentioned the business school had one. But is this community involved? Is there an innovation center, you know, affiliated with the health system here?
I don't know. Whatever happened? Okay. Could be. Unfortunately, I spent 10 years traveling all over the world for other people, so I kind of lost track with what was going on here. There was iBiblio still around? No?
I hear a yes.
And I mean, that was quite an incubator. A lot of ideas came out of there and went into the business world, and some of them thrive. So, Yamna, did you look up those?
Does she have the microphone?
Microphone.
Okay, they are artificial intelligence developer. AI ethics officer.
AI ethics officer.
And AI ethics specialist.
AI ethics specialist. Okay.
And finally, AI practitioner.
AI practitioner.
And all of them has job description and responsibilities.
Excellent.
One of the other students online said there is a digital health innovation class.
Excellent.
And Deborah.
Yeah, I just want to emphasize professional organizations like ACES. I'm familiar with HIMSS, but we also have the Association of Information Science and Technology. And for the librarians, the ALA is the biggest group in the country, really. and they have different specialists as well as the Medical Library Association. So I encourage my students, but they didn't listen. There was one teacher who said, well, you won't have to get a textbook if you'll join the SLA or something like that. And they've now merged with ACES. So yeah, those professional groups have good meetings that you can give talks at, meet people, and as you said, Allison, network,
Yeah.
definitely.
So if I may, because I was asked to come talk about careers. There's a lot of groups. You're in a great place here in North Carolina. There's one called NC Tech, and they have meetups. Sometimes it is a North Carolina society, so they have meetups kind of everywhere across the state, but they do have quite a few in the Triangle area. They just did one at UNC Health's IT offices in the Research Triangle Park. Completely free to attend, network with all kinds of people interested in health informatics. I picked up a few contacts from there, and that's one thing I've always done. It's a little corny, but your network is your net worth as you're trying to take some of these innovations to market. This is a very complex field, as you all know. I learned multiple things new every day. I'll never stop learning. That's one thing about this field. And I think having that network of people that are experts in different avenues, someone that's clinical, someone that's done bedside care, someone that's technical, someone that knows how to program in R, bringing that cohort together and building that network as you're starting off your careers in health informatics is so important.
What about the business incubators?
Yeah. There's a lot of those now. And I do believe UNC Healthcare has an innovation arm. I do know one of the health systems in Charlotte, formerly Atrium Health, now Advocate Health, has an innovation arm. They have a chief innovation officer. UPMC in Pittsburgh has an innovation arm. And what these organizations do is they kind of allow groups like yourself that have got, the idea about the early detection of heart failure, come in. It's kind of the Shark Tank idea. Pitch your solution. What outcome does it deliver? And do you need, an opportunity to kind of get this into clinical trial to see is there a market for this? Does it solve the problem? Does it change the patient's outcome? And there's actually private equity investors that will put funding towards this, which is just absolutely fascinating. We've got our base EHRs, but we're nowhere near done. If you guys follow HIMSS and the EMR adoption model, the HIMSS MRAM, where I think it's like 6 or 7 layers of adoption, from the very basic level 1 is having a lab information system and a radiology information system, and I believe a pharmacy system, all the way up to level 7 now. I haven't looked at the diagram lately, but getting to, these more sophisticated. There's still tons of organizations that are nowhere near level 6 or level 7.
So if you're starting out in the field, should that top level be your target, or should it be wherever it is above where your organization, let's say, is now?
Great question. I think it's definitely easier. There's maybe less barriers to bringing a new innovation in, working with a more digitally forward organization. But there's also organizations out there, there's rural markets that are healthcare deserts still, that don't even have the most basic, applications that maybe we're, fortunate to have here at UNC here in Chapel Hill. So there's applications to take things to rural health. Maybe the barrier is a little bit lower there. Sometimes, trying to deploy it first in an academic medical center brings its own challenges. So I wouldn't discard the, maybe working with rural health organizations. They're a lot of times very open to innovation. There's all the legal bit and the privacy and the HIPAA you have to get through, but once you kind of address the regulatory piece, you might be surprised that there's this broad world out there that, you can take innovations for heart failure where there's barriers to accessing care, et cetera. Yeah. Yeah. Ah, yeah, absolutely. Absolutely. I would get outside of, so we're here in Orange County. We've got kind of Orange, Wake, and Durham counties right here that we have, large employers, major medical centers. If you get to Eastern North Carolina, kind of in between the Triangle and I'm going to say Wilmington, there's lots of counties that, did you know there's not even a practicing dentist in some of our Eastern North Carolina counties? So I do think if you can partner with some of these rural organizations, and UNC's done a lot of that, they do manage some of our critical access hospitals in the state and have partnerships. There's also institutions in the western part of the state where access to care is still an issue, transportation to actually, get to your appointment. So I do think there's still a huge need for innovation in rural healthcare.
So last week, Friday, I was at a meeting of the North Carolina Global Health Alliance, and they were talking about it as in transition, and that one of the areas that one of the reasons I had been involved with them for a number of years was in informatics internationally. So one of the things I would say to an international student is, you can take this and go home and find a lot of things that need work that, that can support you. And if you want to, you don't have to go home, but you may go someplace else to a different country to be able to bring this kind of a perspective and set of skills to bear. But when you do that, whether you're in a low or middle income country or a low or middle income county in Eastern North Carolina, how do you make the transition of what you learned in this premier organization, this institution, to what you face on the ground? What pointers would you give somebody in that situation?
Yeah, that is an excellent question. And you have excellent training here and you have an excellent support system. So try to be open-minded. They may not have Epic, because what did we say? It was more than $1 billion. So you're not going to find, a system like that installed everywhere. Unfortunately, it's just financially not possible for some of these institutions. So I think take some of your key learnings and share that knowledge with those rural health organizations. And the other thing I would do is spend time, if you're working in a hospital, for example, this is one thing I've had the opportunity to do, is just go to each department and shadow their workflows and see how things are done, because you might find that they have to do things a little bit differently in a critical access facility that's in a rural area. Everything from how, triaging the patient, and they might have to stabilize and transport. They might use telemedicine a lot more because they don't have a specialist that's on site. So really try to understand the customer's workflow. So that's one piece of advice I would give.
Sorry to what you said earlier, to listen to the patient.
Yeah.
Part of this would be to listen to the people in these settings express their needs in their own way, their own language.
Yep. Listen, and I'll bring that back. That's one thing I've always stayed true to. I must have had some good mentors along the way. If anybody's lean trained, it's called Go to the Gemba. I'll let you look that up. So go to the Gemba, the place where the work is taking place, and, observe how are the clinicians in these settings, taking care of patients. Maybe they don't have barcode medication administration at the bedside. They might still be doing that using a paper MAR, or medication administration record. So try to immerse yourself and understand what their workflow is, and then how can this innovation, and it may not even have to be that complicated. There may be some basics of the foundation that are not even implemented in some of these institutions yet. So how do we get them to a foundational level that improves outcomes?
So we're closing in on the end of our session here, but I would like to ask, as we've bounced all over the place here, what are your thoughts? Try to, perhaps if you can, summarize a little bit what we've discussed.
Yeah. So what we've tried to talk about today are some careers in healthcare IT. So hopefully we hit on a few spots on that. And I was asked to come in, volunteered to come speak and learn. I want to hear, hopefully I'll get a chance to talk to some of you after our little podcast is done, learn a little bit about, what you're studying and what your interests are. I've had the great pleasure of working with commercial teams that have both brought product to market that's failed and succeeded. And I've been in commercial roles for most of my career, where we are trying to get, most of my career has been working with hospitals to get them to implement this technology. And how we do that is you have to show that it moves the needle on an outcome, whether that's clinical, financial, or operational. So as you embark in your careers in health informatics, I couldn't even imagine what, there's so many, these 4 new AI roles that you just mentioned at the back of the room. There's going to be something new the next year and the next year. When I was kind of starting my career, Chief Nursing Informatics Officer was kind of a brand new thing. And now a lot of institutions have nursing informaticists that really kind of understand how a nurse, in different care settings provides patient care, and how does the IT support that? Tools like barcoded medication administration. So I've got kind of 3 or 4 parting pieces of advice that other people gave to me that I might share. And the first one is the varied background. Embrace that. If you're clinical, form a partnership with maybe some technical experts, because I think that different viewpoints, whether you're a public health background or IT or information and library science or engineering, kind of having that multidisciplinary team, because these are really tough problems to solve. And blending that different perspective and having that collaboration can really help. And I think the prediction is the future of health IT is going to be something around the intersection of AI and evidence, and how is that going to come together, and really lean into the AI. I know it is a buzzword, and you get in a closed door room with health system CIOs and they don't even want to talk about it. But I would say lean into it, try to understand what data governance means, interoperability, how is that going to affect the use of the AI? To your point earlier, can we use the AI to upgrade the code? Because we have innovations that are maybe built on archaic systems or older, they don't even support the latest version of Windows, if you will. You run into that all the time. And the other thing we talked about was networking. Don't wait until you get your degree to start doing that. There's lots of industry groups, whether it's HIMSS, Health, Chime. There's a conference called Vive. A lot of these conferences, I know they can be a little bit expensive to attend, but if or in even the NC Tech group. And there's some of them that offer, virtual opportunities to get involved in just networking. And that's how you find out about opportunities. I had a phone call earlier today. I'll just share this. A consultant I worked with in the past lives in Canada. They're working on an AI solution. It's kind of like ambient AI, but it's for the patients. And they've got it deployed at a couple of health systems in Canada. And she called me and said, we're thinking about commercializing this thing in the US. Do you want to help us? I said,
Interesting.
tell me more.
Yeah.
And I would have never gotten that phone call if it hadn't been for networking and just staying in touch. And this individual is so smart in so many ways, you know, in a different, brings a different talent set. So start building those networking circles, I would say today. And then my last parting advice, I don't know if this is part of the curriculum, but learn, especially in the US, and I can't speak to other countries' health systems as much, but learn the revenue cycle
Mhm.
because it matters so much. How is care reimbursed? We talked about ICD-9, ICD-10 codes. You know, try to spend some time. We get a lot of times the focus on the clinical innovation or the diagnostic innovation. We forget about the revenue cycle and how the insurance companies work and the payers work, at least in the US. And that's something vitally important to understand when you're trying to innovate.
Deborah Swain, you got your hand up again. You get the last question or comment.
I just wanted to add how lucky we are to have in this consortium folks from East Carolina. And you talk about rural areas. They often bring in speakers and researchers that have looked at other items, but east of I-95 can sometimes be another world. But we're a great consortium here. We've got Wake Forest and Charlotte, and we thank David and Jenny for making it work. And you are a great close for this semester. Thank you, Allison.
Thank you.
And we're out of time, folks. I'm Dave Potenziani. Good night.
All right. Next up.